Have you ever faced a moment in life where you knew something had to change? For me, it was a trip to Cancun. Beautiful beaches, amazing friends, but one huge problem. I could barely walk without pain. That moment made me realize that I couldn't live the rest of my life limited by something I could control. Before we start, if you're new, welcome. If you're a regular, welcome back to Aging with Grace and Style, where we celebrate the journey of growing older with confidence, grace, and a touch of sass. I'm your host, Valerie Hatcher, and I'm excited for you to join our community of fabulous women as we navigate the joys of and challenges of life after 50. So grab your favorite beverage. I've got mine. Sit back and let's get started. So today, I'm sharing the story of my hip replacement surgery, how it changed my life, and what I learned along the way. The turning point for me was a trip to Cancun. We went for a friend's birthday, and typically I'm active. I love to walk, to run, to explore, you name it. But this trip was different. I couldn't walk far without excruciating pain in my hip. And let me tell you, it was like I had aged 30 years overnight. That pain was relentless. I grimaced and tried to appear to be okay, but I wasn't. I remember thinking, this isn't me. I can't imagine living the rest of my life like this. I'd always envisioned being active, not just for myself, but for my future grandkids, being able to run and play with them and not be held back by something that I could control. And whether or not I had surgery was something that I could control. It was a defining moment for me. So let's rewind a bit. The hip issues, they didn't appear overnight. I first started noticing them after I went back to working in the office full time. Before that, I'd been working from home, staying pretty active, moving around throughout the day. But going back to the office changed everything. My commute was a 3-hour drive each day. And once I got to work, I was at my desk almost all day, except for quick bathroom or lunch breaks. And then when I got home, I was sitting even more just to get work done. My life became so sedentary and my body paid the price. I was living at the doctor's office, trying physical therapy, getting Arosty treatments, anything to relieve the pain. And at one point, they even thought it was my kidneys. But nothing provided long-term relief. I gained weight during this time, and honestly, I just felt miserable. Totally not me. Then finally, I went to an orthopedic surgeon, and that's when I got the real diagnosis: osteoarthritis, bone on bone in my hip. We tried steroid injections, which gave me relief for, I don't know, about half a day. But ultimately, the only real option was surgery. I'll be honest with you, I didn't want surgery. My aunt had hip replacement surgery years earlier, and her recovery was not easy at all. That was my only point of reference, so of course, I was hesitant. I kept thinking, is this going to be me? The idea of a tough recovery, it scared me. But the pain became unbearable. And even with all those fears, I knew I couldn't keep living the way I was. Even though I was scared, I knew I had to make a decision to improve my quality of life. I needed more information. I didn't want to just jump into surgery without doing my homework. So I started looking into other options, other approaches that might be less invasive. So here's where things get interesting. One day while I was at the hair salon, one of the stylists told me that he had hip replacement surgery about a year earlier. He mentioned that he used one of the best surgeons in the area, and this doctor was one of the few who performed what he called the anterior approach, which was less invasive. So I decided to make an appointment, but the wait was long. It took months to get my initial consultation, and then it took another 5 months to get a surgery date. But he was absolutely worth the wait. So let's talk about the types of hip replacement surgery. As I said, the hairstylist had mentioned the anterior approach that he had. And then, ironically, one day I was talking to my personal trainer, and he mentioned how some athletes were having this newer procedure called the anterior method of hip replacement surgery. Well, that was ironic because I had just had this conversation with the stylist at the hair salon. So that got my wheels to turning. I started to do my research, and here's what I learned. There are a few different approaches to hip replacement surgery, and the type you choose really depends on your doctor's recommendations and your personal needs. This is when, so the anterior approach, rather, this is when the surgeon makes the incision at the front of your hip. It's less invasive because they don't have to cut through major muscles, which means a faster recovery and less pain afterwards. This method, it's becoming more popular, especially for active people like me. Then there's the posterior approach. This is the most common method where the incision is made at the back of the hip. The recovery time can be a bit longer because some muscles are cut during the surgery, but it's a tried and true method that many surgeons prefer. Then there's the lateral approach. With this method, the incision is made on the side of the hip. It's less common nowadays, but it's still an option for some patients depending on their situation. So after talking it over with my doctor, I decided on the anterior approach. It felt like the right choice for me, especially because I wanted to get back to my active lifestyle as quickly as possible. And while I was still nervous, I felt a lot more confident going into surgery, knowing that this approach would likely lead to an easier recovery. So let's talk about the surgery itself. It lasted a few hours, but of course I was asleep, so I don't really remember much. But what's amazing is that today they often do hip replacement surgery as an outpatient procedure, depending on your age and your health condition, meaning that you can go home the same day. Fortunately, my doctor decided to keep me overnight because of a family history of blood clots, and I'm glad he did. The pain that first night, y'all, it was tough. Thank goodness for pain medication. They had me up walking the same day, which was just really mind-blowing to me. Because I had stairs at home, they even taught me how to climb the stairs the day of the surgery. On day 2, I went home. The nights after were difficult. I slept downstairs because even though I was shown how to get upstairs, I wasn't ready. And besides, the kitchen was downstairs. It was hard to get comfortable. I bounced between the bedroom downstairs and the sofa. Neither was any more comfortable than the next. And plus, I had these compression boots on to help prevent blood clots. So that was an extra challenge. The doctor had instructed me to get up and walk for 10 minutes every hour during the day. And icing and staying ahead of the pain with pain meds, that was my best friend. So this was not a time for me to try to be tough and not take the pain meds that he had given me. My recovery, it really wasn't too bad. The first 2 weeks were probably the hardest, but I tried to stay focused on my long-term goals. I was off the walker in about a week because I was determined not to use it for long. I think the first week I used the walker, and then in the evenings with the walker, my husband and I would walk up the street so I could get my walking in. Then by my week 2 appointment, I was on a cane and I started physical therapy. See, I had told my surgeon that I needed to be able to wear heels and to dance at my son's wedding, which was 10 months from surgery. I continued to walk outside most days using the cane and practicing what I had learned in therapy. Now, what's crazy is that in therapy, I had to learn how to walk all over again. And I had walked with a limp for so long and overcompensated for the pain that I had to really retrain my body. By 6 weeks, I was walking on my own. And I was so happy when I was told that I could get back on my Peloton and start working out again. Of course, with modifications and in moderation. I remember telling God that if I got the chance to be active again, I would never take it for granted or skip workouts. It's funny how we make those promises, right? Well, I've mostly kept it, though I've had my moments, but on the regular, I am working out and I am active. But, I've gotten questions from people on Instagram about my journey. And so I thought I would share a couple of them here. So let's dive in. One question that I often get is, why did you decide to go through with the surgery? Well, for me, it came down to improving my quality of life. I couldn't imagine living the rest of my life in pain. So surgery was my best option. Another question is, how long did the recovery take? It was about 6 months before I really felt back to normal, but more so from a workout and flexibility perspective. However, it is an ongoing process. As a matter of fact, the doctor said it takes about a year to totally heal internally. I found that I have to stay active, and honestly, while I don't always do it, I really need to stretch every day. I can always tell when I haven't stretched for a while or when I've sat too much. It doesn't feel like pain, but it feels tight and sore. And yoga is great. And then the last question is, was it worth it? Absolutely. My quality of life has improved drastically, and I'm able to do the things that I love without pain holding me back. 2 years later, I can say that hip replacement surgery was one of the best decisions that I've ever made. I'm back to being active and enjoying life again. I don't feel self-conscious about walking with a limp since I don't have one. I'm back in my heels when I want to wear them. And most importantly, I danced at my son's wedding, and I'm about to soon be chasing a little granddaughter around the house and the park. Wait, I probably need to get on that treadmill to work on my stamina to prepare for the toddler energy. On a serious note, I tell everyone who asks that if you need to do it sooner than later. You just don't realize how your quality of life changes until you get it back. Now, I hope my story helps you feel empowered to take control of your health. Advocate for yourself. Do your research and make the best decision for you. Your health is the greatest asset, and taking care of yourself is your number one priority and definitely worth it. So if you're considering it or you're about to have surgery, a great resource is the Total Hip Replacement Forum on Facebook. It was a lifesaver for me during recovery. And I'm going to link it in the notes in case you want to access it. So that's it. Thanks for tuning in today and for letting me share this journey with you. Remember, if you have questions about anything related to what I went through this hip replacement journey, feel free to DM me on Instagram or contact me at pod.agingwithgraceandstyle.com or even leave me a note in the comments. And remember, if you like this episode, be sure to share it with somebody who might be thinking about the need for hip replacement surgery. And if you haven't already done so, please subscribe to the channel so that you don't miss any episodes. Until next time, stay fabulous and keep shining.